If you are healthy and have a normal pregnancy, it is safe and encouraged to exercise during pregnancy. It's always a good idea to check with your OB to make sure that you don't have any complications with your pregnancy that would change these recommendations. In general, we recommend 150 minutes of exercise spread throughout each week. This can be done in shorter bursts of 10 minutes throughout the week, or be done in 30-minute increments 5 days a week. If you're already exercising, it's safe to continue the exercise that you're already performing, although it may need to be modified throughout your pregnancy. If you're not exercising, we typically recommend starting slow and working your way up. If you have questions about exercise or need help modifying your current exercise program, our physical therapist can help with that. Most exercises are safe during pregnancy, but there are some that we recommend avoiding, including any kind of contact sports where you could risk falling or being hit in the abdomen. We also recommend avoiding downhill skiing, hot yoga, and scuba diving.
During pregnancy, women tend to stick out their abdomen, and this can create some low back pain and some pressure on the abdomen. And those are things we want to try to avoid. So I want you to start at your feet. Think about where your weight is. Kind of rock back between your toes and your heels and really find that center at the arch of the foot. Good. Then I want you to focus on your knees. So don't let them completely lock out. Try to let those knees be nice and relaxed, but you don't need to be in a squat. Next, we're going to talk about your pelvis and your rib cage. So there are 4 points. Here's the end of the rib cage. Here are the points in the pelvis. Right now, they're a little bit expanded from each other. I want you to think about trying to pull those 4 points together, a little bit of a rib tuck. So the optimal posture in pregnancy is knees in line with pelvis, in line with rib cage. This may feel a little bit hunchy, like you're leaning too far forward, but this is actually a nice alignment, and this is going to help reduce that low back pain, pressure through the pelvis, and pressure through the abdomen that you may be experiencing. In this video, we'll go over mechanics on how to lift up some household items like a laundry basket throughout your pregnancy. First, what I'm gonna have you do is lift the box. So we're going to hinge at your waist, bend those knees. You can grab the basket, bring it close to your chest first, and then I want you to stand up. Good. Now to put the box down, we're gonna do the same thing in reverse. So keeping the box close to your chest, I want you to hinge at the waist, bend those knees, and then place the box down. Using this technique can help prevent any strain on your back. A few things you want to avoid are rounding your spine, holding things too far from your body, or asymmetrical movements. Now we'll go over a way to lift a child or a pet at home. What I want you to do is the same thing we did to lift that box. So we'll bend at the waist, the knees, and then pull that weight towards your chest. So I'll let you try that. Keep close to your chest, then stand up. In order to prevent any hip or back pain while carrying a child, I want you to actually try to shift your hips more midline.